The heart is by far the most important organ of the circulatory system, as it has many anatomical parts that are responsible for delivering blood to the body and circulating it throughout, hence why the heart is considered a pump. Now, the heart consists of 4 chambers, 2 atria at the top and 2 ventricles at the bottom. The right atrium receives oxygen-poor blood from the body and pumps it into the right ventricle. The right ventricle then pumps that oxygen-poor blood to the lungs. The left atrium receives oxygen-rich blood from the lungs and pumps it into the left ventricle, which then sends that blood out to the body. Each minute, the heart pumps out a specific amount of blood. This is referred to as the cardiac output, which can be calculated by multiplying an individual's heart rate by their stroke volume. Anatomically speaking, everyone's heart is virtually the same, but it's been proven that there are changes in the shape and functionality of an athlete's heart as opposed to the heart of a sedentary person. This is due to the increased demands on their body as a result of extended or intensive exercise. The term that is now used to commonly characterize this concept is athlete's heart. When considering athlete's heart, there are 2 main forms of training: aerobic training and resistance training, which both have proven effects on the left ventricular wall of the heart. Aerobic training refers to any exercise that requires endurance, examples being long-distance running or swimming. These types of endurance exercises cause the left ventricular wall to dilate, allowing for increased blood volume in a process called eccentric hypertrophy. This is supported by a concept by the name of Boyle's law, which describes the inverse reaction between pressure and volume. Resistance training, however, is any type of strength training which includes activities such as weightlifting and wrestling. Resistance training also affects the left ventricular chamber in a process called concentric hypertrophy, which is where the wall thickens, leading to an increased pressure within the chamber. Well, what does all of this mean for athletes? Athlete's heart is simply a natural and subtle alteration that takes place in the hearts of people who engage in rigorous athletic training. It's not a medical disease. However, more severe changes in chamber size or wall thickness can be linked to heart muscle illness, which can be reversed by the athlete detraining. That being said, it's critical that cardiologists do testing to identify normal and abnormal when athletes appear with any heart-related symptoms, so that proper treatment and rehabilitation can be established for the athlete in order for them to return to play.